Australian scientists will infect healthy people with malaria in a bold new research project boosted by $10 million in funding from Microsoft founder Bill Gates. The funding will help scientists at the QIMR Berghofer Medical Research Institute in Brisbane to fast-track development of malaria drugs. The research, led by Professor James McCarthy, will see the testing of promising candidate antimalarial drugs in healthy volunteers inoculated with a small number of malaria parasites, without putting them at risk. The grant, from Geneva-based Medicines for Malaria Venture, was provided by the Bill and Melinda Gates Foundation. Speaking from the Northern Australia Investment Forum in Darwin yesterday, Trade and Investment Minister Andrew Robb said investment in treatments for diseases such as malaria and dengue fever was a major focus for the region. The economic burden of malaria alone reaches into the hundreds of millions of dollars each year, and the human cost, of course, can be much greater, Mr. Robb said. Almost half of the world's population is at risk of malaria. It continues to kill more than 500,000 people a year, 75% of whom are children under 5. Speed and cost have been critical factors in the development of new, affordable medicines for the debilitating disease. Medicines for Malaria Venture Chief Executive Dr. David Reddy described the research by Professor McCarthy's team as a pioneering initiative. The team is an outstanding example of Australia's capacity to incubate new ideas and knowledge, and translate this into new tools, in this case, for the development of new medicines for malaria that will have important social and economic benefits to Australia, Asia Pacific, and the rest of the world, he said.